Health officials had warned, we had talked about this on the show together, COVID-19 pandemic, the winter would be the most difficult. And it seems this prediction is coming true when we look at these numbers. December was devastating. And right now we're looking at a January that could be even deadlier.
Yeah, I mean, it's very predictable, but very disheartening. This is the effect of all the travel. And then weeks later, we see the impact coming through. And it's definitely hitting New York bad, but there are areas, where we have hospitals in Houston, for example, really at a crisis stage. In LA, you've all been hearing about, has been problematic. Houston is now having an uptick, and New York is having its uptick. Not at the exponential rise that we saw back in the early spring, but it's definitely on the rise.
I know your health system operates 137 hospitals, 1,000 care sites, 21 states. I heard one of the doctors in California calling this a viral tsunami.
It is. I think that we're managing. We're opening up new ICUs. We're opening up new beds. Actually, in Phoenix over the weekend, we had a whole supply of new beds that were getting delivered and had to be, built over the weekend so that we could keep up the pace with this number of patients. I think everyone's heard the issue of staffing. I am personally just so concerned for our healthcare workers and their burnout rate. They are so heroic, and how can they keep this up? It's like being redeployed into a battlefield, again and again and again. And I think we're focused on mental health right now for our providers, the number one issue.